And then there's obviously all sorts of commercial challenges. The business has been around for 11 years, and we're fortunate to be in a space where bringing innovation to patients is always so critical. But there come times like during COVID, for example, where there is a bit of a sentiment in the industry around, oh my gosh, what's going to happen? Can we really invest? Can we bring new therapies to market? Is the healthcare ecosystem even going to be the same tomorrow, right? So things like that are so far outside of your control. But as a business, you need to be able to manage that uncertainty. You need to manage the ability to get the job done. You need to manage payroll. You need to manage so many different things that, things are going to get thrown at you and you need to figure out what to do with them. And obviously that's part of the challenge, also part of the joy.
Welcome everyone to the Bedsides and Boardrooms podcast, where we speak about the intersection between business and medicine. Today, we are going to be speaking about the challenges of starting a medical business. Lavni, welcome to the podcast.
Thanks, Nathan. Thanks for having me.
Just as a quick introduction, can you just tell us what you do?
Yeah, so my name is Lavni. I run a company called Becoya, which is a consultancy based in Dubai, in the UAE. And really the focus that I have in the company is to make sure that we're bringing innovative therapies to the Middle East. We work with a lot of different biotechs, a lot of different medical device companies, pharma companies, on their strategy to support getting their products launched to the patients that need them the most.
Yeah, I always think that it's incredible to work in the innovation space, because I think coming up with new solutions to things that haven't been done before is just an incredible place to be in. So congratulations for the success you've had so far. And I'm interested to hear what challenges that you've had starting a business, maybe in the Middle East, but just more in general.
Yeah, I mean, setting up a business is never easy, as I'm sure you know. Anybody that's been down this road always has, a series of ups and downs. So yeah, I mean, there have been obviously plenty of challenges on the way, plenty of opportunities too. But I think some of the challenges, from my perspective, have been personal, and then some have been more sort of environmental. So on a personal level, I mean, I set up the business when I was fairly young, had very little or no network to really speak of. And I think if you're setting up a business, really sometimes having a network of industry peers who you can learn from, who can support you, who can guide you, who can even potentially become clients, is really critical, right? And so if you're starting later on in your journey, and that's something that you sort of inherently already own. Whereas in my case, that wasn't really something I had to kind of give myself this stepping stone. So I think that was a big personal challenge. But I think on the flip side, it kind of makes you really dive deep in, and it gives you the need to really put your best foot forward and to find these opportunities, because they're not going to find you. So I think, ultimately for me, it was a blessing in disguise. And then there's obviously all sorts of commercial challenges. The business has been around for 11 years, and we're fortunate to be in a space where bringing innovation to patients is always so critical. But there come times like during COVID, for example, where there is a bit of a sentiment in the industry around, oh my gosh, what's going to happen? Can we really invest? Can we bring new therapies to market? Is the healthcare ecosystem even going to be the same tomorrow, right? So things like that are so far outside of your control. But as a business, you need to be able to manage that uncertainty. You need to manage the ability to get the job done. You need to manage payroll. You need to manage so many different things that, things are going to get thrown at you and you need to figure out what to do with them. And obviously that's part of the challenge, also part of the joy.
You mentioned some of your personal challenges, and I think these are always those things that we forget about entrepreneurs, or maybe when we look from the outside, we see, someone that is extremely successful and they look like they've got their life all together. But everyone Doesn't matter who you are. You might be Elon Musk, you might be the richest man in the world, you might be someone that is struggling on the streets, but everyone has got their own personal challenges. So, without without diving into too many personal things, can you elaborate on some of those personal challenges that you've had? We were just chatting before the episode about you've just welcomed your child into your life. So yeah, I think 5 months you said. So that's a real challenge of your time away from what you would normally be spending on your business. So if you don't mind, just giving us some of those challenges that you've had.
Yeah, I mean, I think, the era of women in business is now, if not ever before. And, I think motherhood is one of these things that it changes you, but it also drives you. And then from a purely, let's say, tactical standpoint, I mean, it does take away time from your day to day, but it brings you a lot of joy in other ways. And I think, the idea is, as any female professional would tell you, I mean, it's really about the support system that you have. So, having a great partner, a great family, great village, whatever that village looks like is really critical. And of course it's a challenge. Of course it takes away, the first few weeks. It's, I wasn't really particularly hands on. But that's also where your great team comes in, right? So for me, my village is my personal village, which sort of allows me to actually dedicate time to my work. But on the flip side, the village is also your team, right? The team that can get things done even when you're not around. And so both of those factors have such an important role to play. And I think it's been really critical. The other side, I think, just as a female founder, there was always a bit of hesitation around how do you share the news of your pregnancy? Do you share the news of your pregnancy? What is the perception going to be of how serious you're going to be taken on your existing engagements? Are you still going to be around to conduct those engagements? So there was also, quite a lot of fear around, is this something that can and should be shared? And that kind of almost felt like this ethical dilemma of, is it okay to hide? Is that the right thing to do? Is, how do you navigate that? And so that to me was definitely a challenge that I didn't expect. I think everybody expects, the not to have time and to potentially be sleep deprived, but these kind of conversations I hadn't really expected going in, which is something that did come about.
Well, I mean, if you think about it, you find out like what about in the fifth week of pregnancy, and then we only went. Well, I said we. My wife announced the pregnancy in the 12th week or 12th or 13th week. So there is this awkward period where you obviously know that you're pregnant. Like things are changing. I mean, my wife had a lot of challenges with this, like hormonally, lots of things are changing. Things are changing in her body, but now she can't go and tell everyone. Can't go out. Just have a glass of wine or something like that. Have to make these kind of excuses and. So that's definitely a challenge. But you did mention in the beginning about network, and that's something that I've personally, starting my own business, I won't say struggled with, but just it came to me how important a network is. That's when you really realize how important it is, because for my whole career before, I would just I wasn't actively meeting people. I wasn't actively trying to go out and meet people. The people that I worked with was the people that I interacted with professionally. And outside of that, I didn't really try and foster relationships outside of that. Which I think that's a little note of wisdom that we can put into this, that no matter what your job is, you can always be networking. But when I started the business, then I really struggled with this idea of networking, because you go to networking events and it just feels kind of, maybe forced, maybe feels a bit, awkward, or just a bit weird to meet people like that. And then you obviously go to conferences and those kind of things. You're trying to speak to people. So those are the ways that I try to build my network. But can you just give us an idea of how did you go from, kind of no network to a bigger network, wider range of people that you were interacting with?
Yeah, I mean, it's a mixture of sort of a lot of proactivity, a little bit of hustling, a little bit of you don't ask, you don't get sort of approach. So, I mean, conferences and networking events are obviously the most common things, and I agree. I mean, conferences, everybody's there for the same reason, so it's not as awkward. But networking events, can be uncomfortable if you're not used to them. So I definitely did my fair share of uncomfortable ones before becoming more comfortable in that space. And the other side is the more virtual way of doing things. So whether you're kind of connecting with individuals on LinkedIn that you think would be up for just grabbing a coffee face to face or online, that's always really helpful. Asking your friends for referrals to people that they may know, or whether that's old colleagues more often than not, in the same space, that's always really helpful as well. Um, and I think outside of that, maybe even treating networking as not something that's necessarily exclusively for professional reasons. Recognizing that networking can be professional, but it can also be personal. You may make a friend. You may find somebody who's in a book club that you'd like to join. It could be anything. And I think just putting yourself out there in the world, regardless of the setting, can have, huge implications. And if you kind of try and take that lens versus looking at it exclusively as this thing where you need to go and you need to dish out business cards, it kind of takes the pressure off a little bit as well, which is always nice, because no one wants to go in and kind of have, a target. I must meet 10 people and I must exchange, 6 business cards. It's a nuisance.
No, and I think those kind of organic style meetings, and if you actually take interest in people's lives outside of just this kind of just knowing people just for a network or just professionally, I think that can help as well. So that's one of the challenges that you've overcome, because you're 11 years in. So what are some of the other challenges that you've had starting a business and maintaining a business?
I mean, others are around talent, for example. That's always a challenge, making sure that you have the right people on your team. Um, when you work in an industry that is particularly niche, as is the space that Becoya operates in, you really need to find talent that is within this very specific niche that can kind of get the ball rolling quickly. And so the idea is to be able to be flexible in how you recruit. But more importantly, also, the small company is retaining that talent, right? So it's not just about having an environment that people want to join. It's having an environment that people want to stay in, where they're flourishing, where they're growing. And, as a small company, you're not always able to compete with the likes of larger major corporations who have entire teams that are dedicated to making this happen. So it then becomes a really personal approach, right? What can you do as an individual to create this cohesive environment that people enjoy working in, that they have good opportunities to be in, and where they're also consistently growing to something bigger for themselves in as well. And I think that's a challenge, if it's not something that you're used to having done before, to even put on that hat and to take on that role in addition to everything else that comes with running a business. It's not the easiest to navigate, and it's so critical, because who you work with is such a major part of your day to day. So it becomes this really critical strategic step and strategic process that I don't think people entirely know what it really takes to make it successful until you really get into it.
Well, I think that is a real challenge, especially for the startups. How to get good talent in and then retain them. I can tell you, we've just done a drive, and we did like a LinkedIn, and we tried to recruit through that way. But before that, um, I never actually hired anyone trying to look for people. All the people that have come through the business or have worked for us actually approached us.
Wow.
And that's not it's not a kind of a brag. What I think is that I like it when I find someone that would look into our business and say, I want to be involved in that, and
Yeah.
then approach us. And I sometimes don't always have something for them, and I'll say, okay, well, just contact me in a couple of months' time, or kind of make up something for them and get them involved in some way. But that's the way that I've approached it, to say, those that have come to our business and said, I want to be involved, what does it tell you already? It tells you it's someone that has got initiative, someone that's looking for something, someone that will, maybe go the extra mile for you. So that's the way that I found, and it's been like relatively successful so far. But how do you go about, say, recruiting people, getting that
Yeah.
team, building that strong team around you?
I think it's a mixed bag. It's a mix of what you've mentioned, so sort of the inbound as well as the outbound. I think you need to have a balanced approach depending on what the roles are that you're hiring for. And again, that niche becomes really important. So we do fortunately get a lot of inbound interest as well, and we've been fortunate that similarly we've been able to sort of carve out roles or projects and positions for folks that are very talented. On the flip side, where we're looking to sort of expand beyond that, LinkedIn is a great tool. I don't love the idea of job specs, but sometimes you have to do it. But what we prefer to do where possible is use LinkedIn or other tools as a way of sort of sourcing folks with the right experience, having initial chats. We don't want to bog down people with interviews when we're approaching them. They may have heard of us, they may not, but they may not even be in the market, right? So we try and keep a fairly relaxed process, which we can do at our size, just to have a chat to see if there's a mutual interest in having a deeper conversation, and a deeper sort of skills assessment. And then once we're sort of past that initial phase, then we kind of conduct this more detailed deep dive into skills and that kind of thing, just to make sure there's a good fit.
That's an interesting way of doing it. So it's just a casual chat to start out with, and then moving into something that's a bit more, like a bit more serious, like a longer, like a longer interview. So that's an interesting way of doing it. Then how do you go about retaining your staff once you found this these amazing people? What are some of the things that you do to retain them?
So I mean, it's one of these things that we're always building on. I think obviously in order to have great talent, you need to make sure that the opportunity is meaningful. That applies in sort of the actual nature of the work, as well as, of course, the compensation structure and everything that comes with that. Outside of the sort of obvious things, I think we we try and ensure that there's a team that kind of cohesively works together. So we have sort of team building activities. We work remotely, so we do a lot of these virtually. We sort of have like monthly sessions where we all sort of play virtual games, things like that, just to kind of keep things lighthearted as well as focused when they need to be. We're also sort of always making sure that we're available to discuss non-work things or ideas that are adjacent to the day-to-day, but not necessarily part of the job spec. And we're inspired to do this by Google, which has sort of a percentage allocation of employees' time that they can spend on not their core job. So we have, for example, somebody in our operations team who is fascinated by AI and building tools and using AI in creative ways. Now, that has nothing to do with his actual day-to-day job, but by virtue of having the space to play, he's actually created, I think he's now on his fourth tool for us that's been automating a bunch of the work that we're doing anyway. And so it's kind of creating that space and giving teams freedom. So knowing that, individuals often work best when they're not in a very high pressure zone all the time. Sometimes a little pressure is good. But where they have the space to create, I think becomes really meaningful. And we try and ensure that that's sort of part of our ways of working, which I think has been a really nice way to see people shine in very different ways.
So most of the time, you're actually just trying to get out of people's way. Just let them do what they want to do. Um, they'll find the solution. I think that as managers is an important skill to have. To trust your team and allow them to do the things that they want to do in the time that they want to do it. Obviously, I
Yeah.
mean, there's client pressure and that kind of stuff, which you can't get around always. But yeah, so
Yeah.
so some of your projects that you worked on in Saudi Arabia is launching rare disease solutions. So can you tell me a bit more about that?
Yeah, so a lot of our clients work in the rare disease space, so they will have innovative therapies for various rare diseases, whether it's I don't know, sickle cell disease or thalassemia, multiple sclerosis, lots of different disease areas that we've worked in. And really, our job is to help these companies make sure that the patients that need their products will ultimately get access to them. And so that's making sure that they get the regulatory approval that they need, that they can price at a point that is commercially sustainable for them, but more importantly, that's going to get them funded by health insurance. So that patients who need these products can actually have them subsidized either fully, that is often the case in Saudi, or at least with a large percent of it already covered by their health insurance. So we try and ensure that everything that we work on results in ultimately having that end goal with the patient getting access.
Okay, so you're more working on delivering that solution to the patient.
So yeah, I mean we're focused on the strategic side. So we act as the advisors for pharma companies that are looking to get their products in, supporting them kind of navigate and preempting some of the challenges they might face when launching their therapies into the kingdom.
Okay, so what type of challenges have you, without giving away too many of the secrets, trade secrets, but what's some of the challenges that you need to overcome in order to launch a product or a medication in a region?
So for rare diseases, there's very few patients, right? I mean, by virtue of being rare. And what that means for pharma is that ultimately the commercials need to make sense. So they need to be able to sustainably ensure that patients get those products. And so often the price points are higher than for another disease, for example, for diabetes or cardiovascular disease. Um, Ultimately, the trickle down effect then comes in for funding, right? So, how can governments or insurance companies afford high cost therapies? That's one of the bigger challenges that we work on, right? And we help companies sort of find creative solutions to manage that, whether it's finding sort of innovative payment schemes, whether it's having shared risk between who is ultimately paying or versus the pharma company. So it's finding sort of the more creative solutions to get to market. Other challenges that are faced are, for example, if companies have a product where physicians or health insurance companies don't necessarily understand or see the value in a given therapy because it's a rare therapy. So they may not have even heard about the disease, let alone see value in a drug for it. So, how do you communicate the value of that? How do you communicate what this patient, who might be a one in a million patient, but why this individual needs this therapy? So part of that sort of strategy around value communication of different therapies is a big part of what we do as well.
So in order to get a therapy for a rare disease, there's so many steps that need to take place in order to get there. I mean, the patient needs to be diagnosed, identified. There must be some screening, diagnosis. There must be some kind of knowledge of the practitioner to provide the therapy. So that must be an interesting space to work in. How do you go about finding those patients? Do they just kind of pop up in the healthcare system? or do you do some kind of screening? Or is it more physician led?
Yeah, so we're not involved in the actual patient finding. We're involved in understanding what patient volumes can look like. It helps sort of the forecasting for pharma companies around what they need to prepare for. But in terms of how the patient finding works with pharma companies, there's a few different ways. Sometimes there's screening programs that are run nationally, for example, for newborn screening for certain diseases. Children are screened at birth. Others have, if there are certain symptoms for a given disease, then they would be screened at a different level or a different part of the journey of that individual patient. And often for rare disease therapies, there's only really a handful of physicians that are able to treat very complex cases. So it would be those key physicians that would sort of have their finger on the pulse in terms of how many patients am I actually seeing? How many patients are there that are going to maybe other referral centers? Because again, there's only going to be a handful. We work in the Middle East as a whole, but if given the example of Saudi, there's probably 4 to 5 major hospitals where patients with rare diseases would be going. And so, you're able to sort of drill down to the right physicians within those to get an accurate assessment of where the patients really are.
And there's, I guess, a geographical challenge as well, getting the patients in to do the therapy, having the therapy available, that it's been manufactured at the right dates and expiry dates and everything like that. So I think that's it. I hadn't thought of healthcare in that way, because a lot of the diseases that we would treat, I mean, I'm from the emergency medicine spaces, a lot of the same old types of diseases. It's the patients with myocardial infarction or the patient that has a trauma, so we treat a lot of the same things. If one of these rare diseases came across my plate as a practitioner, I'm not sure that I'd be able to pick them up because we don't see them very often. So, working in the innovation space, how do you balance kind of commercial success with your broader goals of creating innovative solutions within healthcare?
So ultimately everything comes down to what does the patient need, right? I think anybody that works in the health or pharma space is doing it with this purpose of this kind of patient-led angle. So everything that we do drives towards where are these patients? How can we get them the treatment that they need, that is the best treatment for them, and how can that be funded? So that's sort of always the goal. I think, when we think about what it really takes, I think the recognition that ultimately, whilst everybody has an intention around getting patients the treatment that they need, that everybody looks at it from a different angle. And ultimately, we work in this world where there's so many different moving parts to get therapies to patients. There's a clinician, there's the patient, there's the caregiver, there's the funder, there's the supply guy, there's the distributors, right? And each of these ultimately have the same goal, but their way to get there and the incentive structure around that is different. And unfortunately, those are not aligned, right? Those incentive structures are not always well aligned. If you look at even somebody who's going to be paying for treatment, of course, they want to ensure that a patient has this $1 million therapy if they need it. But how do they balance that against, providing 1,000 diabetes therapies to another 1,000 patients that need it, right? So they want to do it, but they have conflicting priorities. So I think a lot of, the challenge and getting the job done is just recognizing how to work within this kind of cross-functional world that we live in, where despite aligned objectives, what moves the needle is different in each case, right? And you kind of need to learn how to work within those different brains that there are so that ultimately the collective objective can be met.
I think it's a nice way of thinking of it. And just as you were speaking there, I was thinking about how complex healthcare can be. I mean, there's so many factors that go into it. There's obviously getting the patient to the clinician. There's, all of these things that need to take place. And I don't think in other businesses, I mean, there are different types of challenges. But then ultimately we deal with patients' lives, which is that extra ethical responsibility that we have. So what drives you? What drives you? Is it the getting more projects, seeing your projects come to life? What is it that that drives you to wake up every morning and slog on in a business? Because business is difficult. There's no doubt about it. It's difficult. So what drives
It
you?
is. It is. No, that's a great question. And I think the beauty of the consulting side of things is that you're always learning something new. As I said earlier, we work in rare diseases quite often, but that's a huge bucket in itself. So one day you're working in sickle cell disease, the next day you're working in thalassemia, the next day you're working on cystic fibrosis. I mean, it's never ending. And so I think for me, the ability to actually pick up something new and be excited every day because there's something new to be looking at, a new problem to be solved is always really exciting. I think it makes the career in itself, the foundation that the business is built on, it makes that part really exciting. And if I look then at, the business owner side of things, right? The person who's not a consultant, but that's running a business, that in itself there's just new things every day, right? There's new people, there's new teams, there's new stuff to do with AI, right? So how can you kind of incorporate all of that in the way that you work? And then more on a personal level, one of my core values is freedom. So the ability to kind of pick and choose what I do with my time, pick and choose my clients, pick and choose the projects that we work on. That is really, really critical to me as an individual. And so I think a combination of all of these things have led to this, beautiful mess, should we call it, of what makes my life and what makes sort of my business what it is today.
It's a good way of describing it, because it's never just one thing. A career that spans many, obviously, decades, and by the end of your career, it's not going to be one thing that drives you. There's going to be multiple things. So that's interesting. So we always do on the podcast one question that is unseen, and which we haven't discussed before, and this one is actually touching on what we just spoke about in terms of what drives you. But I would want to maybe have an honest answer to this question. And the simple question is like, what drives you in the business? Is it money, or is it creating new things and innovation?
See, do I have to pick one of those two, or can I pick another answer?
No. You got to you got to stick your flag to the mast. You have to do one. You can give a nuanced explanation, but then give one. Choose one.
I think this applies to me both personally and professionally. And I think for me, it's the creativity. And I say this because ultimately, as a business owner, you have to focus on your revenue potential. You can't have a team and make ends meet if not. But I think what has to be the driver, and it can't not be the driver, is the creativity and the solution building. Because if you're not doing that, the money's not going to come in anyway, right? So in our industry, no two solutions, no two strategies are ever the same. What excites me the most, what gets me out of bed, is when we've come up with something really, really cool for a client to do. And that's obviously then going to have financial implications, of course. But is it what motivates me? No. Is it a byproduct of it? Absolutely, it has to be.
Yeah, I think obviously it's a bit of a, not a trick question, but maybe a question that has got multiple answers, because I think you're right. In order to run a business, you need the funds. but just from my personal perspective, what I really enjoy, and that's what I found out with starting a business, is actually coming up with solutions to problems. That's in a nutshell what a business is just hundreds and thousands of problems that you're just finding small little solutions to, some big things that you need to correct, and some small things. And every day you kind of have something new, and you need to think of something new, and you need to do something different, which is not for everyone, and not everyone's personality is like that. But yeah, that's my answer. But thank you so much for coming on the podcast. I really appreciate your time. And just before we end off, where can anyone or our listeners find your company and your services?
So they can find me on LinkedIn, Lavni Varyani. They can find the company on the website, which is Becoya.com.
Brilliant. Thank you so much, and thank you for joining us.